Okay, this is the last one, calcium. I save it for last because it's not as much as common as some of the other ones, but calcium is Ca. This is why you might think, why do we need to know that periodic table? Well, this is kind of one of the reasons why you need to know that. But the ranges for your potassium level, your calcium level is 9.0 to 10.5. And what does calcium do for us? Well, one of the biggest things that calcium does for us is keeps our bones strong, keeps our bones, our teeth, all of those calcium things that keep everything going like they should. So it keeps all that strong. It also has to do with clotting factors. So the calcium does play a little part in our blood in the clotting cascade, and it does do a few things with the heart, but some of the other electrolytes do a little bit more than that. So if we have a low calcium level, so we got a low calcium level less than 9. So how would we get a low calcium level? Well, if you think about how would we get low? Okay, so let's go back and think what could cause a low calcium level? Well, we're going to be getting rid of calcium somehow. Well, how would we get rid of calcium? Well, there's 3 ways. We can have an increased calcium output. So that patient's had chronic diarrhea and they've been getting rid of a lot of their calcium. They've been using lots of laxatives and it's causing a lot of that calcium to go out. And then sometimes in pancreatitis, we get something called steatorrhea. And steatorrhea just is fats that don't get digested. And for whatever reason, that calcium binds to that and the calcium level goes out. So sometimes with pancreatitis, if they have steatorrhea, that will cause some of that low calcium levels. Now, inadequate intake or absorption of calcium. Well, just like with anything else, if your stomach, duodenum system can't absorb it, then you can't get it in. So if it can't absorb it, you can't get it in. Or if you're not taking it in, you can't get it in. So malabsorption syndromes, that would be sometimes like your Crohn's, your ulcerative colitis, your ulcers, all those kinds of things. A vitamin D deficiency. So vitamin D deficiency, you cannot absorb calcium without vitamin D. So if you do not have vitamin D, you can't absorb calcium. So the doctor orders a test on your vitamin D and your vitamin D is really low. I would expect your calcium level to be low because you have to have vitamin D to absorb the calcium levels. Now, the reason that someone's vitamin D would be low, one is alcoholism. So that is chronic alcohol abuse. Chronic or kidney renal disease can cause that lack of vitamin D production, and lack of sun. So those are the 3 things that we don't get absorbed. Now, sometimes you can get a shift in your extracellular fluid into the bone or to an inactive form. Now, the most common one I could see with that one is probably going to be hypoparathyroidism. So I know that's a big term, but inside your neck, you have your thyroid gland, and behind your thyroid gland, you have 4 little glands. They're called the parathyroid glands. Those parathyroid glands regulate your calcium level. So if those little glands inside there aren't working and they're not keeping your calcium level where they're going to be, you're going to get hypoparathyroidism. Okay, because they're not producing enough of that hormone to keep your calcium levels where they need to be. So that would be some of the reasons why you might get a low calcium level. Now, what are you going to see? This is where I'm going to talk about tetany, I'm going to talk about Chvostek's and the Trousseau sign. So we have a patient and they come in and they got numbness of their fingers, and this person comes in and they said, I had a cramp in my leg to the point that it was excruciating pain and it was so tight I couldn't move, I couldn't walk. That's tetany. That is probably the worst Charlie horse you will ever get, and it'll take the patients to the emergency room because it's painful spasms, and it's because that calcium level is so low. A positive Chvostek sign. Chvostek sign is where you take and you tap on your 5th cranial nerve right here. You tap, and if you tap, you will start getting facial twitching right there. So if you get that facial twitching after tapping, that's a positive Chvostek sign. Now, a positive Trousseau sign, if you go to take their blood pressure, you put the blood pressure cuff on, you pump it up, and their hands in the hand and the fingers start to spasm, that is a positive Trousseau sign. So if you ever go in and you're taking a blood pressure on a patient and their fingers start to do this little funky stuff or start moving really weird, that's a positive Trousseau sign. That is a good indicator that their calcium levels are off. Cardiovascular, calcium can cause some cardiac dysrhythmias, but I'm more worried about the muscle twitching and the tetany up here. So these are other things. So if your calcium gets really low, that means that there's no calcium in your bones. So what happens to your bones? So your bones are going to get weak. So you might have an increased tendency for spontaneous fractures. So spontaneous fractures might be that you're running out of the house and you step on a step and your back goes, oh my gosh, that hurts so bad. You go to the hospital and you actually had a fracture in your spine because the bones were just weak. Okay, so that's something. And then we could also have some clotting issues because we did say that it also helps with clotting. Okay, so what are you going to do? Well, first you're going to have to give calcium. We're either going to give calcium orally or we're going to give it IV. If you're going to give it IV, it's very irritating to the veins and it can cause some skin irritation. So you might want to watch that. You're going to have to give a vitamin D supplement because if we don't give vitamin D, you can't absorb the calcium. Seizure precautions and fall precautions. So if their potassium gets too low, that can initiate a seizure. So sometimes we will go ahead and have seizure precautions and we will have suction equipment available. And we want them to have a diet high in calcium. So that's going to mean your dairy products, your milk, cottage cheese, all your dairy products, and dark leafy green vegetables. So those are going to be things that are going to be high in potassium. Now we're going to talk about hyperkalemia. So this is a calcium level over 10.5. This one is not as common as your hypo, so we're not going to see it as much. But the reasons we can get it is your diuretics, because we're pulling out all those electrolytes. Somebody that has had steroid use over a long period of time, because steroid use we also know causes osteoporosis or osteopenia, which is usually lack of calcium in those bones. It can cause hyperthyroidism or hyperparathyroidism. So if they have hyperparathyroidism, that means that remember those 4 little parathyroids in the gland up here, they're hyperactive and they're like overacting and causing you to release too much calcium. And one of the big things that we see though is if you have a patient that has had cancer and they come in and they're getting lab work and their calcium level comes back really high, that many times is a red flag to your doctor or your hematologist or your oncologist that they have some type of cancer in the bone, because the cancer invades the bone and pushes the calcium out. Okay, so that can happen. Patients that are in bed, your bedridden patients, your immobilized patients, all of them are going to have a tendency to have that osteoporosis. So those are the causes. Now, what are you going to see with hypercalcemia? Bone pain, because all that calcium came out of the bone, so they're going to have that bone pain. A lot of them will get kidney stones, but if you think about it, if they have high calcium levels, calcium is what causes kidney stones, so you may see increased kidney stones. So they get that increased kidney stones in there because that high levels of those calcium buildups. So what are you going to do? You're going to restrict calcium intake, so we're not going to let them have as much calcium. So we're going to decrease that milk, decrease that calcium, that cottage cheese, those cheese, all that kind of stuff. And we're going to look for those pathological fractures. So we're going to look at those patients that may have cancer that it has invaded their femur bone, or maybe it's invaded a certain bone. So if they move their arm or leg or something a certain way, they could actually fracture that leg. And they really didn't do anything to fracture it. They just stepped on it. So it's the bones get very, very brittle. We're going to kind of restrict, we're going to watch those loop diuretics to get rid of that calcium. So we're going to give them those Lasix and things like that to get rid of that calcium. Okay, and that is it. I know this is a lot. fluid and electrolytes is a lot, but I tried to put it in short little segments. Okay, so I'm going to pull up another PowerPoint and just show you guys really quickly, which I know that this is not ideal, but I wanted to kind of show you water balance. So if you think about when we did water balance before, and I told you about hypotonic, isotonic, and hypertonic. Okay, isotonic is this little guy right here. It's equal. It's isotonic. It means that your water and your sodium and your potassium, everything is in the compartments where they need to be. Everything is going great. We are good. Now, what happens in hypotonic? Remember the O? The cells get big. So now Susie Salt is in here inside the cell, and Willie Water's like, okay, I'm going to come see Susie. So he barrels into that cell and causes that cell to get really big. Okay. If that cell starts to lyse or break, that means all of that sodium and all of that potassium is going to get spilled out into that tissue. So that's how we're going to end up with some higher potassium levels too. So we got hypotonic. Now, if we have hypotonic, we're going to come over here and give them hypertonic solutions to make the water get out of there. Okay, so it's the opposite of what we're going to do. Now, if we have hypertonic cells, this means all the water is leaving. That means Susie Salt is out here somewhere, and Willie Water's going to go get her. So when that happens, the cell gets shrinky. So then we're going to give them a hypotonic solution, and we're going to pop it in there, and we're hoping we're going to blow that cell up. Not that big, but we're going to blow it up where it's normal now, and we got level, everything is level. So I just want you to kind of, hopefully that you understand that and you understand what I've talked about. Please ask questions because I can answer them the best that I can.